Hi and good day to everyone. So we are the Group C and our topic is all about the narcotics antagonists, and anti-migraine agents. But I will start off with the narcotics, specifically the narcotics agonist. Okay, so short description about this agent. Okay, so the narcotics agonists are drugs that react with the opioid receptors throughout the body to cause analgesia, sedation, or euphoria. So the anticipated effects other than analgesia are, of course, mediated by the different types of opioid receptors affected by each drug. So because of the potential for the development of physical dependence while taking these drugs, the narcotic agonists are considered or classified as controlled substances. Okay, so here are the examples of narcotic agonists. So it includes codeine, the morphine, the opium, oxycodone, oxymorphone, and many others. So by the way, the words in the parentheses are the brand names of the different drugs under the narcotic agonists. Okay, so next would be the indications. So relief of moderate to severe acute pain or chronic pain, preoperative medication, component of combination therapy for severe chronic pain, and intraspinal to reduce intractable pain. Okay, so moving along, here are some of the important aspects to remember for the indication of narcotic agonists and different age groups. So we first discuss for the children, the indications for the children. Okay, so safety and effectiveness have not yet been established in children. However, the narcotics agonists have established some pediatric dosage guidelines specifically only for codeine, fentanyl, except transdermal, and the hydrocodone, meperidine, and morphine only. Okay, so naloxone is also the antidote for narcotic overdose and the reversal of the narcotic effects. Okay, so next would be the indications for the adults. Okay, so first and foremost, they should be informed and reassured that the associated abuse with the use of narcotics agonist drugs in acute pain is remote. They should also be educated about the importance of asking for pain medication before the pain becomes acute. And caution is also advised for pregnant and lactating women because of the potential adverse effects to the fetus or the baby, or what we call the teratogenic effects. Okay, so narcotics is also used in labor, including the morphine, meperidine, and oxymorphone. And another one is all narcotic agonists, or yes, all narcotic agonists are pregnancy category B except oxycodone, which is considered as pregnancy category C. So it might be the drug of choice if one is needed during pregnancy. Okay, next for the adults. So since they have existing medical conditions due to their age, so their health is somewhat deteriorating or they become weak, they are more susceptible to the drug adverse effects. And so safety measures should still be established for them. For example, side rails or the call lights or call buttons, and of course the assistance to ambulate or walk or do physical activities or things. Okay, so next would be the mechanism of action. So these narcotic agonists or opioid agonists, analgesics, act as agonists to specific opioid receptors in the CNS to produce analgesia, euphoria, and sedation. So it also binds predominantly to the mu receptors. So when we say mu receptors, they are defined as the primarily pain blocking receptors, also account for respiratory depression, euphoria, and the development of physical dependence. Okay, so for the pharmacokinetics, here are the characteristic interactions of narcotic agonists in the body in terms of its absorption, distribution, metabolism, and excretion. So I'll just be showing the table as a summarization of its pharmacokinetics. Okay, so here is the table. So usually for the intravenous administration or the IV, it is actually the most reliable way to achieve therapeutic levels of narcotics because it is directly injected through the veins, which is a faster way. And for the IM or the intramuscular administration and the subcutaneous administration, it actually offers varying rates of absorption. So when it comes to absorption, there's a difference between the female and the male. So for the female, of course, the absorption is slower because of the normal fat content of the female muscles and the tissues. Okay, so also for these drugs, they undergo hepatic metabolism or what we call the liver. So they are metabolized mostly in the liver. Okay, so next, they are generally excreted in the urine and the bile. And for its half-life, it actually varies widely. So it depends on the drug being used. And lastly, these agents also cross the placenta and are known to enter the breast milk. Okay, so next. Okay, so here are some of its side effects. So for the CNS, for the central nervous system, the common side effect would be the lightheadedness. So when we say the lightheadedness, this is a feeling when you're about to faint or pass out. So usually the best intervention would be making the patient lie down in his or her bed. So another CNS effect would be dizziness, fear, anxiety, and others. Okay, for the GI or gastrointestinal side effects, most common is the nausea, vomiting, or constipation. Next, for the GU side effects, we have here the urinary retention, hesitancy, and the other side effects are sweating and of course the physical and psychological dependence on the drugs. Okay, so we have also here the narcotic induced respiratory center depression, which is one of the side effects. Basically, there is a respiratory depression or shock and many others.
So next we have the contraindications. So the following are the contraindications and cautions for the use of narcotic agonists. So we have here first the allergy to narcotic agonists. So it prevents hypersensitivity reaction. Next, diarrhea caused by toxic poisons. So drug depresses GI activity and this could lead to increased absorption and toxicity. Next, respiratory dysfunction. So exacerbated by the respiratory depression caused by drugs. Next is the recent GI or GU surgery, acute abdomen ulcerative colitis. So it can be worsened by the GI depressive effects of the narcotics. Next is the head injuries, alcoholism, delirium tremens, cerebral vascular disease. So it can be exacerbated by the CNS effects of the drug. So next is the liver renal dysfunction. It can interfere with metabolism and excretion of the drugs. So lastly, we have the pregnancy and lactation. So potential adverse effect to the fetus and the baby. We call this one the teratogens. So let's move on to the drug to food interactions. So drug to drug interactions involve in the use of narcotic antagonists. So we have here the barbiturates, phenothiazines, MAOI. So it increased likelihood of respiratory depression, hypotension, and sedation or coma. Next, we have the SSRI, MAOI, TCA, and St. John's wort. So in here, it increased risk of potentially life-threatening serotonin syndrome. So if taken by tapentadol, so the newest narcotic antagonist that blocks norepinephrine reuptake in the CNS. Next is, lastly, we have the methyl naltrexone bromide. So it is the treatment for opioid-induced constipation in palliative care patients who are no longer responding to traditional laxatives. So next, we have the nursing considerations. So in all age groups, there is a great variability in the doses of opioids needed to produce pain relief. So even among patients with identical surgical procedures, this variability highlights the need for analgesic orders to include provision for supplementary doses, used to intravenous boluses and infusion to provide rapid relief of severe pain, and the need to careful patient monitoring, and also elderly patient and those with central nervous system disease should be observed carefully during dose titration to minimize the adverse effects. So also we assess the source, quality, and severity of the patient. So we also keep in our mind that pain is a subjective experience. So when a patient's report of pain, it should be we should be believed. So next we have the use non-opioid analgesic when possible. So giving an opioid along with the non-opioid may increase analgesic effects and allow a lower dose of opioid to be given. Next, we have the monitor the patients. We monitor the patient's vital signs and mental status regularly. So we report if the pulse is below 50 beats per minute in adults or 110 beats per minute in infants. Also, we monitor for decreased respiration. So opioids may decrease the patient's cough reflex. Therefore, it is important to have the patient turn, cough, and deep breath regularly to prevent atelectasis. Next is we give the opioid drugs at least 30 to 60 minutes prior to activities or painful procedures. We also monitor the patient closely when an opioid is given, so as sedation for painful procedures. So next, opioids may also cause urinary retentions. So opioids may also cause urinary retention. So we monitor the patient's intake and output. We palpate the suprapubic area of the abdomen for bladder distension. So we ask the patient about any voiding problems, pain in the bladder area, and sensation of not completely emptying the bladder, or any unusual odors in the urine. So lastly, if the patient is confined to a bed, we use side rails and safety measures to prevent a fall when receiving opioids. We provide assistance with ambulation and transfers. Thank you.
Okay, so next is narcotic antagonists. So narcotic antagonists are a classification of drugs which block the euphoric and all other effects of opiates. The narcotic antagonists in use include naloxone or Narcan and naltrexone or Revia. So next is the indication. Next reporter, please.
So the indication for the narcotic antagonist is indicated for complete or partial reversal of narcotic depression, diag- diagnosis of suspected opioid overdose. So some of the important aspects to remember for indication of narcotic antagonists in different age group is first in the children. The safety and effectiveness has not been established in children, and naloxone is the antidote for narcotic overdose and reversal for narcotic effects. So, in the adults, they should be informed and reassured that associated abuse with the use of narcotic in acute pain is remote. And then they should also be educated about the importance of asking pain medication before the pain becomes acute. And then caution is also advised for pregnant and lactating women because of the potential adverse effect to the baby or the fetus. So in the older adults, they are more susceptible to drug adverse effects because of the existing medical conditions. And then safety measures, which is also advised for them and also be established, like the side rails, call light, and assistance to ambulate. So next reporter for the mechanism of action.
Okay, so mechanism of action. Narcotic antagonists are drugs that bind strongly to opioid receptors but do not activate them. They block the opioid receptors and reverse the effects of opioids like respiratory depression and sedation. So next is pharmacokinetics. So here are the characteristic interaction of narcotic antagonists in the body in terms of absorption, distribution, and metabolism and excretion. So narcotic antagonists may be administered parenterally, subcutaneous, IM or IV, or orally. These drugs are well absorbed with injection and are widely distributed in the body. And they undergo hepatic metabolism and are excreted primarily in the urine. Next slide po. So ayan po yung route. IV, 2 minutes yung onset niya. Peak is unknown. And yung duration po niya is 4 to 6 hours. Next is yung IM and subcutaneous. 3 to 5 minutes yung onset. Peak is also unknown. Duration is same with IV, 4 to 6 hours din po. Ayan. So, T1 or 2 is 30 to 81 minutes. Yung metabolism niya is liver, excretion, kidney, or yung urine. Next po. Next slide po. Ayan. Side effects. So, CNS, excitement, reversal, or analgesia. Yung CV naman po, tachycardia, blood pressure changes, dysrhythmias, and pulmonary edema. Next is acute narcotic abstinence syndrome. So, nausea, vomiting, sweating, tachycardia, hypotension, tremulousness, tremulousness, and feelings of anxiety. And next is a naloxone challenge should be administered before giving naltrexone to help to avoid acute reaction contraindication. Yes, acute reactions. So next po is yung contraindications. Ayan. Allergy to narcotic antagonists prevent hypersensitivity reaction. Pregnancy. So lactation, potential adverse effects to the fetus and the baby. Narcotic addiction. So precipitation of a withdrawal symptom, and CV disease exacerbated by the reversal of the depressive effects of narcotics. And next is drug and food interaction. So there are no significant drug-to-drug interaction involved with narcotic antagonists. Ayan po. So next po. Ayan, nursing consideration. Next report po.
Let us now proceed in the nursing consideration. So first, we have to assess a patient's opioid use before therapy. Also, we have to assess effectiveness of drugs regularly throughout therapy because the duration of narcotic may exceed that of naloxone, causing relapse into respiratory depression. Also, we have to monitor the patient's respiratory depth and rate because patients who receive naloxone, an example of this drug, to reverse opioid-induced respiratory depression, which may develop tachypnea. Also, we have to monitor the patient's hydration status if adverse GI reactions occur, and evaluate the patient's and family's knowledge of drug therapy. Also, we have to instruct the patient and family to report adverse reaction. So, for the nursing assessment, next slide, please. Okay, so first we have to assess for mentioned cautions and contraindications like the drug allergy, history of narcotic addiction, or myocardial infarction. This is to prevent untoward complications. Also, we have to conduct pain assessment with patient so that we can establish a baseline and evaluate effectiveness of drug therapy. Also, we need to perform thorough physical assessment, which include neurological status, respiratory rate and rhythm, vital signs. This is to establish a baseline status before beginning a therapy. Also, determine drug effectiveness and evaluate for any potential adverse effect. Also, we need to obtain an electrocardiogram as appropriate. This is to evaluate for the cardiac effects. Okay, next slide, please. Okay, so these are the vital nursing interventions done in patients who are taking narcotic antagonists. So first, we have to maintain an open airway and provide artificial ventilation and cardiac massage as needed to support the patient. Also, we have to administer vasopressor as ordered and as needed to manage the narcotic overdose. Also, we need to administer naloxone challenge before giving naltrexone because of the serious risk of acute withdrawal. We also need to provide comfort measures to help the patient cope with withdrawal syndrome. Also, we need to provide safety measures. Example is adequate lighting, raised side rails. This is to prevent injuries to the patient. And we need to ensure that the patients receiving naltrexone have been narcotic free for 7 to 10 days to prevent severe withdrawal syndrome. Also, we need to educate clients on drug therapy to promote understanding and compliance. Next slide, please. Okay, so next is the evaluation. Here are the aspects of care that should be evaluated to determine if the drug is effective. Okay, first we have to monitor the patient response to the therapy. Example is reversal of opioid effects and treatment of alcohol dependence. Also, we need to monitor for adverse effects like CV changes, arrhythmias, hypertension, and other more. Also, we need to evaluate patient understanding on drug therapy by asking the patient to name the drug, its indication, and adverse effects to watch for. And also, we need to monitor the patient's compliance to drug therapy. So that's all for the nursing considerations for the narcotic antagonist.
So let's go to narcotic agonists and antagonists. The mechanism of action and indication of narcotic agonists and antagonists. It binds to some opioid receptors but inhibit others. And also they are less addictive than narcotic agonists, yet have a comparable analgesic effect as morphine. So here are the indication: relief of moderate to severe pain, pre-anesthetic medication, and a supplement to surgical anesthesia. The second is may be desirable for relieving chronic pain in patients who are susceptible to narcotic dependence. So the next slide is here are the some important aspects to remember for indication of narcotic agonists and antagonists in different age groups. So we have here children. The first one is children safety and efficacy are unknown. Second, children over 13 should use buprenorphine as opioid agonist antagonist. Third is the antidote for narcotic overdose and the reversal of narcotic effect is naloxone. For adults, the first one is they should be informed and reassured that overuse of narcotic in severe pain is very unusual. Second, they should be educated about the importance of asking for pain medication before the pain becomes acute. And lastly, for the pregnant and breastfeeding women should avoid using this drug due to the risk of neonatal opioid withdrawal syndrome.
Pharmacokinetics of the drugs or drug. So it has road. It can also be used as subcutaneous POIM, and it can use as 15 to 30 minutes. Also, it can take 1 to 2 hours, and the duration of this it has 3 hours. And next is IV, 2 to 3 minutes, 15 minutes. It can be duration as 3 hours. Metabolism, liver, excretion, bile, urine. And next is the side effect of the narcotic agonist antagonist drug. So the side effect in the central nervous system of the person, it can have a side effect like lightheadedness, dizziness, psychosis, anxiety, fear, hallucination, pupil constriction, impaired mental process. That is the side effect when it comes to the central nervous system of the patient when they use the drug. And next is for the gastrointestinal. It can happen the side effect of nausea, vomiting, constipation, like that. And also, it has ureteral spasm, urinary retention, and hesitancy of it. And also, other side effect of it is like sweating, like that. Physical and physiological dependence. In narcotics, it has a respiratory center depression with like apnea, suppression of cough reflex. Next is contraindication. So contraindication meaning to say it is the condition that suggests or indication of the drug. So first it can have a allergic or allergy with the skin or the body of the patient or the person who are using the drugs. But it can also be prevented by hypersensitivity reaction. So in physical dependence on narcotics, withdrawal symptom may be precipitated. And also in other respiratory dysfunction, it can be having a respiratory depression like that. And also for the hypertension, you can have a cardiac stimulatory effect with the body of the patient. And also it can interfere with drug metabolism and excretion. And also for the pregnancy lactation, it has a adverse effect within the fetus and also the baby. For the nalbuphine, specifically in contraindication to patients who are also allergic with the medicine, it can be sulfites to prevent cross hypersensitivity reaction. Next is the drug food interaction. So the person who are using this, it can be recommended to the patient to take the narcotic agonist antagonist with food. And also lastly is the nursing consideration. The nurse considered is to consider the following warnings and contraindication of the drug. If there, for example, if it has a drug allergy, narcotic addiction, or myocardial infarction to the patient to avoid problems. That is very important to know for us to avoid the problems. Next is, of course, we need to assess the patient to have a medication treatment for your patient. And next is have a complete physical assessment. That is very important. We need to complete a physical assessment for the client. And also, we should know what are the effect of the drugs like that, and we need to obtain an electrocardiogram to assess cardiac effect. That is very important that the nursing have a consideration.
Okay, so the next one is the anti-migraine agent. Next slide. Okay, so anti-migraine agents are used to treat migraine headaches. So it acts by increasing the tone of the extracranial arteries and inhibiting the mechanism of neurogenic inflammation or inhibiting pain transmission within the central nervous system. Next slide. Okay, so mechanism of action. It is a dilation and inflammation of cephalic arteries and intracranial extracerebral arteries cause the migraine headache. So the migraine-associated symptoms result from activation of the sympathetic nervous system caused by the pain. So the migraine aura is caused by the neurophysiological phenomenon of spreading depression. So the various mechanisms are tied together and it is so-called parallel theory. So the abortive antimigraine medications act by constricting the dilated arteries through stimulation of serotonin 1B receptor. So the preventive anti-migraine medications act by increasing the tone of extracranial arteries, inhibiting the mechanism of neurogenic inflammation or inhibiting pain transmission within the central nervous system. Next slide. Okay, so pharmacokinetics. So here are the characteristic interactions of ergot derives by the body in terms of absorption, distribution, metabolism, and excretion. So we have route, we have sublingual, onset, rapid, peak 0.53H, and the duration is not. Next slide, and next reporter, please.
Okay, here are the side effects. Injection site pain, constipation, muscle spasms, rash, mouth ulcers, high blood pressure, dizziness, and then headache, palpitation, flushing, chills, chest pain, sleepiness, vertigo, and then weakness, indigestion, difficulty, swallowing, back pain, seizures, and vomiting. So here are the contraindications. It can cause vasoconstriction of the coronary and limb arteries. Therefore, they are contraindicated in patients with a history of myocardial infarction, coronary artery disease, cerebrovascular accidents, hemiplegic migraines, uncontrolled hypertension, or peripheral vascular disease. Other contraindications include severe hepatic or renal failure, as well as the age of 65 years or more. All triptans except for sumatriptan are contraindicated in pregnancy and breastfeeding. It should not be administered with ergot alkaloids or monoamine oxidase inhibitors. Next, drug or food interactions. Among all fruit juices, grapefruit juice possesses high interaction with almost all types of drugs. The juice modifies the body's way of metabolizing the medication, affecting the liver's ability to work the drug through a person's system. So here are the nursing consideration in oral anti-diabetic agent. First is always check blood glucose levels before giving. Second, it is usually given 30 minutes before meals. Administer the medication at exact time with meal or when food is in sight. Third, alpha glucosidase inhibitors are given with the first bite of each main meal. Last, metformin is taken with meals to reduce GI effects. And that's all. Thank you for listening.